I'm a board-certified dermatologist, and today I'm explaining Alma TED, one of the most talked about new treatments for hair restoration. I'm Dr. Dina Strawn, and I help people get to the root cause of their hair loss, especially when many things haven't worked. So let's break down what TED actually is, how it works, and who it's for. TED stands for Trans-Epidermal Delivery. You could think of it as something like PRP, which is platelet-rich plasma, where they draw your blood, spin out the growth factors, and inject them into your skin so that they can go into the hair follicle. But TED is a step up from that. With trans-epidermal delivery, you have plant-based growth factors, a standardized cocktail of them, and then you use ultrasound and air pressure to create microchannels in the skin through which you can deliver the growth factors to the hair follicle to improve your hair growth. So TED is a step up because it involves no blood, no needles, and no pain. The science behind it. The device uses ultrasonic acoustic waves to create temporary microchannels in the skin through which you can deliver the growth factors. It increases blood flow, and it just allows the hair follicle to grow a thicker, more dense hair. So you get better results, a better experience with no blood, no needles, or pain. Who is it for? Alma TED is for anyone with hair loss who has viable hair follicles that can be revived to grow thicker hair. It's FDA approved specifically for androgenetic alopecia or male and female pattern hair loss. However, it can be used on all sorts of scarring and non-scarring alopecia. What's very interesting is that we often think of a scarring alopecia in which the hair follicles are damaged to the point sometimes where they're dead and there's no possibility of hair loss, that you wouldn't be able to use something like Alma TED. But in many of those patients, there are hair follicles that are still viable, and that's an excellent opportunity to use Alma TED to get them to function again. So it can be used on all sorts of hair loss in men and women. Alma TED is also great for people who have used medical treatments for their hair loss that haven't worked effectively or enough, people who are not ready for hair transplant surgery, and people who want a non-invasive solution for their hair restoration. What it feels like. Alma TED feels like a head massage. You get vibration on your scalp. People tend to find it to be a pleasant experience, and you feel some moisture from when the solution is rubbed on the skin. The treatment plan. So the Alma TED treatment plan involves 3 treatments usually that are spaced a month apart. In preparation for your Alma TED treatment, you should come in with freshly shampooed hair that has been dried and no products in your hair. That's it. You come in and you do the treatment, and you keep your head clean and dry for 24 hours after your treatment. And that's how simple it is. It takes about 20 to 30 minutes to have your Alma TED treatment. If you're dealing with hair loss and you'd like to come into my office and be seen as a patient, you can make an appointment at a Glow Dermatology. If you're unable to come in, you can do a telemedicine appointment, or you can arrange a consultation with me using the link provided. We can talk about all your options for hair loss and what you can do. This won't be a formal medical appointment in this case, if you're not in a state I'm licensed in, but I can help direct you to where you can get help for your hair loss or alopecia.